He was a nurse. He killed his patients with overdoses. He worked at 9 hospitals in 16 years. Nobody stopped him. Charles Cullen was a registered nurse who worked at hospitals and nursing facilities across New Jersey and Pennsylvania between 1988 and 2003. During that time, he murdered an estimated 40 patients by administering lethal overdoses of medications, primarily digoxin and insulin, making him one of the most prolific serial killers in American history. Cullen's method was designed to avoid detection. He injected patients with drugs that caused cardiac arrest or sudden medical crises that appeared natural. Because many of his victims were elderly or seriously ill, their deaths were rarely treated as suspicious. He exploited the trust placed in him as a caregiver, turning routine medical care into a deadly opportunity. Despite numerous warning signs, Cullen continued working. There were unexplained patient deaths during his shifts. Coworkers reported that he accessed medications he did not need, and at least one hospital fired him for suspicious behavior. Yet none of these institutions reported him to authorities or properly warned future employers. As a result, Cullen moved from one hospital to another, repeating the same pattern without interruption for 16 years. The truth began to emerge in 2003 at Somerset Medical Center in New Jersey. Staff noticed unusually high levels of digoxin in several patients who had died. An internal investigation revealed Cullen had been accessing patient records and medications without authorization. Police were called in, and Cullen was brought in for questioning. At first, he denied everything. But eventually, he confessed to murdering 13 patients. Over time, he admitted to many more, and investigators believe the true number could be far higher, possibly reaching into the hundreds. In 2004, Cullen pleaded guilty to 29 murders and 6 attempted murders. He was sentenced to 11 consecutive life sentences, ensuring he would spend the rest of his life in prison. The case exposed major failures in the healthcare system. Hospitals had missed opportunities to stop him, choosing to quietly dismiss him rather than report concerns. There was no centralized system to track dangerous medical professionals, allowing Cullen to continue his crimes unchecked. Charles Cullen used his position of trust to prey on the most vulnerable. His actions violated the core principle of medicine, to do no harm. His story remains a chilling reminder of what can happen when institutions ignore warning signs and how easily a killer can hide in plain sight.